Hi everyone, welcome back to the channel. In today's video, we're going to dive into a topic that is very important in healthcare and that every nurse must get right. And that topic is how to transfer a patient from a hospital setting to a nursing home. And to deal with this topic, we are going to discuss the importance of this topic, why it matters, and then the 6 steps that are required for a smooth transition from hospital to nursing home. Let's talk about why this matters. A sloppy handoff can lead to medication error. It can lead to missed treatments. It can lead to confusion for patients and their families. So the first step is for the nurse in the hospital to review the discharge orders for this patient. She needs to know the patient very well, and she needs to go over the discharge orders and ask questions uh, where she has any confusion. It is extremely important to review the discharge orders, the patient very well, even if it's her first day looking after this patient, and that she has to be transferred to the nursing home. She needs to get a proper handover of this patient prior to her transfer. Number 2 point is to prepare the patient. She actually has to go to the bedside of this patient, because most times when patients are being transferred to another facilities that is not their home, they're normally afraid because they don't know what to expect. It's just like going to visit a friend and or relocating to another country. You don't know what to expect. You have to be nervous first off. So it's the same with patients when they are being transferred to nursing homes. And they feel some of them will feel that their freedom will be taken away from them once they are in the nursing home. A lot of people dread going to nursing homes, not because it's a bad place, but because they don't know what to expect. So it's very important to prepare the patient for the transfer. Alleviate her fears, reassure her, give her a chance to ask questions, and listen carefully to her fears and reassure her and her families if they are present. The second step is to communicate with the nursing home where this patient is going. You have to make a phone call. Call the nursing home that will be receiving this patient and give them a verbal handover of the patient. You have to give them the medical histories of this patient. If this patient is diabetic, you have to highlight it. If this patient is hypertensive, you have to highlight it. If she has been on IV antibiotics and then that has been switched to oral antibiotics, that has to be highlighted. If she's on any high tech medication, it is important to highlight that as well. You have to give a brief summary of the medications this patient is receiving. All these points are very important. And you also have to include in your verbal handover if the patient is for resuscitation or not. This is very important. Also, during your verbal handover, you have to mention the nutrition status of this patient. That's the dietary plans as well. And also of any medication allergies or food allergies. And we all know the importance of this, because when you give a patient a medication that she is allergic to, it can eventually lead to death. And when that happens, it is a serious case. So it is important that these handovers are given verbally prior to this patient arriving to the nursing home. The next step is to complete the documentation. What do I mean by completing the documentation? So all the necessary information that you have verbally handed over and more, you have to put them down You have to complete your nursing transfer documents, and together with the doctor's discharge summary, medication prescription, and maybe TVN tissue viability nurse reviews, or speech and language therapist review, any physio reports, and all of that. You have to include all of them in a as part of your documentation. So all these paperwork have to be put in an envelope and ready to be handed over to the care assistants who will be accompanying the patient together with the ambulance crew to bring to the nursing home. And while you're giving the handover as well, the verbal handover, you have to let the nurse you're handing over to know about the mobility status of this patient. If this patient is fully mobile, if this patient is using Zima frame for mobilizing, or she's wheelchair bound, or she, whatever mobility status this patient is, it is vital that it's handed over to the nurse in the nursing home, and as well as apart from the verbal handover, it has to be documented as well. So after completing the documentation, the next thing is to ensure a safe transfer to the nursing home. First off, you have to call the ambulance. Sometimes, depending on the hospitals and depending on how busy it is on the day of this transfer, sometimes there's delay in ambulance services arriving. So you have to make the call. Make sure that all your documentations are ready before arrival of the ambulance crew, or before you make that call. And once the call is made, ensure that the residents' belongings have been packed, and that everything, and there's a checklist of everything the resident has, especially vital things like money, jewelries, and stuff. So, and some of her expensive belongings. Just take a note of what she came in with, and just double check that list when this patient is being transferred to make sure that everything is intact. Most things that are easily forgotten sometimes are patients' dentures. And then they go to the nursing home, they are looking for it, and then they'll be blaming the nursing home, thinking that the dentures went missing in the nursing homes, whereas the nursing staff at the hospital forgot to include the dentures in the patient's belongings. So it's very important to do a checklist, a proper checklist of what the patient came with and what she's being discharged with. So once the ambulance arrives, reassure the patient once again and accompany her to and hand her over to the ambulance crew and wish her well. The final step then is when this patient arrives at the nursing home, is it the care assistant or the ambulance crew will hand over this patient care to the nurse. So, and they will provide an opportunity for the nurse to ask any quick questions. And normally, there is, when the nurse opens the envelope, most of the information she needs will be contained in the envelope. And then, if she has any questions, she can always call the call the hospital for more information. So most times, some nurses shy away from calling. It's better you make make that phone call. If you're not sure of any treatment plan, you have to call the hospital to find out. It's better to call and find out rather than making a mistake that will lead to a big trouble or problem in the future. So, where you don't understand anything, make a phone call and get more clarity into the treatment of the patient. In conclusion, a smooth transition from hospital to a nursing home should be every nurse priority, because when it's done smoothly, It improves the standard of our nursing, and it is everybody's responsibility to get it right. And that's how to do it. Smooth transition, reduce errors. It support the receiving team. And most importantly, give your patient the best care possible. Let's raise the standard of nursing together. If you found this helpful, give this video a thumbs up, subscribe for more nursing tips, and drop a comment if you've ever handled a tricky hospital to nursing home transfer.